All right, Eagles. Well, good afternoon. Thank you for being here. I know it's a different schedule and you're adjusting to something new, but welcome to our first ever. And yes, I am setting you up for a big round of applause, so let's bring that energy. Welcome to our first ever Pro U Speaker Series. Thank you for that unprompted, really warm welcome for our assembly today. Hey, as you all know, what we're after here at CVCS is educational excellence in a Christ-centered environment. But beyond that, we talk a lot about our portrait of a graduate, where we want you to graduate to be courageous Christians, truth seekers, and servant leaders. So we don't want you just graduating from high school with an impressive transcript and getting accepted into a good college, which is all things that we want. We want you equipped to be transformative presences in your communities, in your families, in your church communities, and in your professions. And part of that with professions is figuring out what it is that you are, who it is that you are, what it is that you want to be doing. So the Pro U Speaker Series is an opportunity for you to hear from professionals, from people who have gone before you, who have learned some things, who have stories and can tell you a little bit of their story so that you can learn from them. And in the Pro U pathways, we have the medical pathway, we have engineering, and we have the business and entrepreneurship pathways. So you'll be hearing from professionals in each of those areas. And then those of you who are active in those three clubs will have a lunch with us afterwards, where we'll have an open forum Q&A with our guests. So that's the general format as we do this for the first ever time. And today, I would like to introduce you to our first Pro U Speaker Series guest. Don't give a round of applause yet, Dr. Geoffrey Sigmund. Now, we are honored to welcome Dr. Sigmund, who is a CVCS parent and is a lead radiologist specializing in neuroradiology and musculoskeletal imaging. So will you all join me, please, in welcoming Dr. Sigmund? All right. Well, Dr. Sigmund, thank you so much for joining us today and speaking to our students. As just kind of a kickoff question and to warm things up, I had a brief introduction to you and who you are. Can you tell us a little bit about yourself, about your work, what you do, and why we have you here as a guest to speak today?
All right. It's great to meet you all. So basically, as a radiologist, what I do on an everyday basis is I look at pictures. It sounds simple, but that's really what it is. Those pictures are of human bodies, and those pictures all tell a story. And each person is different. Every person has their own unique anatomy. And more importantly, everybody has their own unique pathology. So on any given study, I might be looking at a, MRI of the brain and have a person who has, MS or a tumor or something scary. And I may be looking at a knee and someone who had an unfortunate accident while playing a sport. And, I'm determining whether or not their ACL is torn. The general, the way I describe myself to people is, I'm basically an anatomist. My job is to know all the anatomy of the entire body and everything that can go wrong with it, which sounds like a lot, and it actually is. But what I don't have to know is how to treat it. So I have to know my part, and I'm a part of a team that does great things. The second part of that question is what I really want to convey to you guys is meaning. Meaning is something that everybody will find in their life. You'll try to find that job that has meaning, and some people will say passion, but generally meaning is what I look at my job, because what I do every day is I tell people what's wrong with them. And sometimes that answer is nothing, and it's great when it's that. But when it is something, you want to be that person who is the expert and dives in and just says, this is what you're dealing with, and really helps that surgeon or that a medical doctor determine what the course of what their treatment path is going to be.
And earlier, you were talking about why you got into medicine when we were out in the hallway and such. And one thing that I would like to know is, as you talk about the why and some of the things that you had said and the meaning and the story that's there, but a little bit first here in this context, what is it that first drew you to medicine? And when did you realize that this is something that God was calling you to?
So my story, I grew up in a very, very small town from 0 to age 8. And my mom actually had me when she was 16. And so I lived with my grandparents, and one of my prime influences in my early life was my grandfather. And so he was a mechanic, like a cat mechanic, like the big tractor trailer guys. But he was the probably the most silent person who did the most good that I've ever known. When I say that I've said less than 5,000 words to my grandpa during his lifetime, 5,000 words is not a lot of words. But he was always there. And so on any given day, we'd be driving to take me to the park or take me to go roller skating or whatever. And if my grandpa saw someone with their car broken down on the side of the road, well, he'd stop. Didn't matter what time it was, didn't matter what was going on. He saw somebody with a car hood open, he'd stop and tinker around, and if he could fix it easily, then he'd fix it. And if he needed a part, well, he'd drive to the part store and get the part and fix their car. And it was never about money. He never asked for a dime, but he gave that model of service that if someone was in need, he was not going to let them be in need on the side of the road in the middle of the snow, etc. And when that like dedication to service is your start. But my transition towards medicine actually came because of Dr. Ben Carson. So in about 1990, when I was I believe it was in 8th grade, so just a little bit younger than you guys, Dr. Carson wrote a book called Gifted Hands. And in that book, he talked about how he came from a child of an illiterate mother. And, by virtue of her passion and her drive and pushing her children, he became the first person to separate cranially conjoined twins, which in the medical world is basically the equivalent of just unbelievable. The anatomy, the surgical precision, just the planning. He had to have basically 2 teams of 27 people to be able to perform this surgery. And yet he successfully performed it. And these 2 kids now had a life, whereas they would have not lived past about age 6 or 7 because of how their anatomy was fused together. And it was kind of that passion that he had for the ability to use his God-given mind and his God-given expertise to essentially perform amazing things for patients who would have otherwise had no other option. And that was when my real passion for medicine started, because, here's this guy, he's just a guy from Detroit, and yet he can, by virtue of his passion and his faith, turn into the guy who can give cranially fused twins a new life. So that was really like my origin of how I came to really just seeing that medicine was something that was a great idea for me. I was a good student anyway, but realistically, like science was like it for me. Like I just love science. And so like kind of seeing a path where I could take that in like just enjoyment for the material and turn it into something great where I could help others was really what set me along the path for medicine.
Okay. And when I hear that story about Dr. Ben Carson and thinking about the conjoined twins, cranially conjoined twins, so connected at the head, and doing surgery to separate them, like the level of expertise it takes to get to that point, and then the high pressure environment in that situation. You're in 8th grade and you hear that story, and that's something that enlivens you to step into that rather than shy away from that. Can you talk a little bit about the motivation behind that and how that was an invitation in instead of something that pushed you away?
I guess I guess you could say I wanted to make an impact, but more than that, like I really did have self-confidence. And we all are delusional as high schoolers, right? Like I was either going to be a doctor or going to be a president of the United States. But the thing is that I do think that I played sports, and I just had really a very supportive environment. My grandparents, my mom were very supportive, and they never let me believe that there wasn't something I couldn't do. And that doesn't mean that it wouldn't be difficult. They never lied to me and told me it would be easy. But at the same time, like, I think that when I see that the ability to have that level of impact on somebody, And if I've got the ability to do it, why not? Why not me? Why wouldn't that be what I was called to do? And so I just, and this was actually before I was a Christian. I became a Christian when I was a sophomore in high school. And so then when I became a Christian, then it became the faith aspect of it too. Like, if God gave me this gift, why not cultivate it? Why not push it to the limit and see how far it'll go and see what I'm capable of doing? And it's not fearlessness. It was more that my ability in school and these types of things, that it wasn't it was on loan to me from God, and I needed to do everything I could to make the most of it.
Awesome. Well, when you talk about, there's a lot of meaning and depth to the motivation that you've spoken of. Can you talk a little bit about, you became a Christian when you were a sophomore in high school, so a little bit of that story and your response to Christ there, and then how does that relationship between you and God and Christ and the world and Christ and others, how does your faith inform the work that you do today?
Well, so medicine is a very deeply human area of the world. Okay, this is not somewhere where you go to work as a financial analyst, you interact with a spreadsheet all day, and maybe you make money, maybe you don't. Okay, in medicine, you are going to see people at their worst day. Period. Full stop. And the ability of a Christian to perform in that environment is unique. Because to someone who, and you will see this as you interact with people in medicine, you will see people who act annoyed that you're there, people who act like as though you are burdening them by needing their help. And then you will see people who will see your suffering and respond to it. And, the human side of it is why Christians often make the best physicians, because it's not, empathy is the wrong word, but it's sympathy. It's understanding, okay, this person is suffering and I have the ability to help. How can I help? What can I do in this moment to help them? And what can I do in a plan to help them in the future? And, the second part of and I speak of this in medicine in general, and is not that doctors are the only part of this. Okay, I can go through every area of medicine, from nursing to nurse practitioners to PAs. Everyone has a vital role. It's very much a team game in medicine. However, I am obviously coming from the perspective of a doctor, but what that element of humanity does is it actually drives me to be better at my job, because nobody wants to walk into a room with a doctor, specifically a radiologist, right? That's what I do. And that doctor be like, what? It could be something. I don't know. Maybe. I don't know. Well, we'll have to find somebody who knows. And it's fine if you're, like a primary care person who's doing that. But when you get to the end specialist, you want somebody to be like, I know that this is what it is. I know the doctor who can help you with this. I'm going to help you on your path. I am here for you. I am here for you no matter what happens. And so, that expertise and that it is drive, but I mean that inability to leave a patient with my second best effort is literally what drives me every day, because I refuse to give my second best effort. If a patient requires me to look at their scan for 45 minutes, I will look at it for 45 minutes. If I can do the scan in 3 minutes, I'll do the scan in 3 minutes. But each patient is my concern. And that level of passion for that expertise comes because Christ doesn't ask me to give my second best. He doesn't ask me to loaf through it. He gave me the ability to do this, and he asked me to push harder than I can to where I'm uncomfortable and then keep going. And through that, I am at a point in my career where there are doctors who don't even, like, if their patient goes to a different radiology facility, they just call me and have me read it, because they know that I'm going to care about their patient. I'm going to give them the right answer immediately. And, again, that's understanding my role in my meaning in this, but I'm just the person who helps them get their plane off the ground, and helps them take care of their patient to the best ability.
All right. Well, think about that, and the the giving your best isn't something that you just start doing. There's habits that are cultivated, and having that heart and everything that's there. We're talking about the course pathways that we offer here. Can you tell us a little bit about your own path to getting to where you are? When we have high school students here who are thinking about college, possible career paths, going to college, changing majors, all of those things are part of it. Can you tell us a little bit about what your journey looked like from high school through medical school, and any advice that you would give to students who are still discerning their direction?
Okay, so I'll start. Medicine's a long path. So I did 4 years of high school. I was at Enterprise High School in Reading. And then I did 4 years of college at Point Loma Nazarene University. And then technically I had to take time off during medical school, but my path would have been 4 years of medical school. And then I did 1 year of internship, 4 years of radiology residency, and then a year of neuroradiology fellowship. So, excepting the time that I took a break, it was 13 years of training. And with that said, I would say that my first 2 years out, when I was on my own, were basically more training. That was probably the hardest time of my life, because I didn't have a professor who already knew the answer standing right next to me. But what I would say to you guys is that no matter what specialty you choose, no matter what career you decide to pursue, number one, don't give up. There is always a path. So for example, I had a friend in medicine. She was a great student. She was, not quite straight A's, but in college, just a great GPA. She didn't get into medical school her first year. She waitlisted. She did a master's of public health, and you know what they call her now? Doctor. Yeah. She had to go a little bit of a different path, and there's always a way. When you find your passion of what you want to do, you can always find a way to do it. Whether that's, hey, I just want to be a physician's assistant, or I'm going to do nursing because I really like the direct care with patients. No matter what area of medicine or what type of impact you want to have, you can find somewhere to do it. And there is always a way to open those doors. Just never accept no. I mean, I can go through and quite easily on Instagram or whatever, I can show you people who are told no for 4 or 5 years and still, what do you call them? Doctor. It just never accept that your path, if you feel a calling, never give up. And, with that said, always be incorporative. There are always people there to help. The most tragic thing that I hear people say in medicine more often than anything else is, I did it myself. I consider that to be one of the most tragic things to be said, because it, one, implies delusion that you think you did it yourself, or two, it implies that you did not understand how much more you could have been helped along the way. What does that mean? Okay, so if you're in the high school program and you're thinking about, hey, you know what, maybe I want to go into medicine, maybe primary care, maybe I want to be a surgeon, I don't know. Well, you can focus on your school, which is great, but you can also ask around. Hey, does anybody know a surgeon? Oh, so-and-so knows this person, this surgeon. He might let you, follow him and shadow him for a day. And then you can walk around and you can see how that surgeon interacts with his patients, and you can see what that patient interaction looks like. And, sometimes you'd be like, yeah, that's not the patient population I want to treat. But sometimes it's like, wow, I can't believe how much that impact that guy had. And every patient was like, thank you so much. Or, you were amazing, or maybe every patient was like, that was the terrible experience. Either way, you'll learn about who you are and what type of interaction you want to have with the world around you. And, to be honest, the parable of the talents is really like one of the things it's the scariest thing in life, because to be honest, as Christians, we're forgiven and it's only by grace that we're saved. And yet Jesus gives the story that if you're given a bunch of talents and you bury them in the sand, he will say, not so good, right? Whereas even if he doesn't give you as much talent, if you take those talents and you do everything you can in the world to glorify his name and to go above and beyond to show his love to people who don't deserve it. And, I'm not the evangelical type. I'm not going to be an apologist, and I'm not going to be the guy like Charlie Kirk sitting on campus convincing people to that my perspective or my point of view is right. I am more like my grandpa. I'm the person that when somebody, whether it's through my family or friends or somebody comes to me and says, I'm sick, I need help, and I don't know what to do. I'm the guy that will jump into the trench and I will fight that war with you to the very end. And those, it's not the glorious type. There's nobody on social media who's going to say, "Oh my gosh, that guy is the greatest." But to the people I have impact on, to the people whose fathers or mothers or even children who they said help and I jumped in with them, they that relationship and that bond is unbreakable. And when you talk about the impact that Christ has on the life, I will do that for anybody. I don't care if they're mean. I don't care if they're Christian. I don't care if they're not Christian. If somebody needs my help, I will jump in, and I will let God work it out. God, eventually, if they'll say, "Why did you jump in with me?" All these doctors, like, they were just completely distracted and dissociated. Why'd you jump in with me? And then it's an easy answer. And that's my faith in Jesus.
Awesome. When we talk about the journey that you've been on, the commitment that was there, and you're also in a career that's demanding, right? And it's high pressure, a lot of work, and people who are counting on you. Can you talk a little bit about the quality of life and how you find balance between calling, family, and personal formation? And are there any habits and rhythms that you have developed to help you stay centered?
So true balance in medicine is it's an enigma. It's very difficult. But the way that I break it down is you have, your faith, you have your family, my wife and my two kids, you have your work, right? And then you have your physical health. And to be honest, to balance all four of those things as a physician is incredibly difficult because, to be honest, the profession demands a lot of your time and a lot of your effort. However, the cheat code to this is that I find Jesus Christ every day in what I do. And my just a quick story. So, for example, we had a patient, and I had been reading this patient's scan. She'd had a very, very rare type of cancer in the artery in her chest, and she'd gone to a very big institution, had that cancer resected, and so post-operatively, we'd been following her for about a year and a half, every 3 months. And I had read all of her studies. And on her most recent study, somebody else read it. And the patient called my office and said, "Can you just have Dr. Sigmund look at it again?" And I'm incredibly busy. My staff is always like afraid to ask me to do stuff. But I heard God say, "Do it. Listen, go." And I immediately went back to the desk. And my colleague was wrong, and she had an aneurysm that had started to rupture in her chest, and she needed urgent surgical attention. And in that moment, I was more connected with God than, quite possibly I've ever been at church, because I heard his voice, I listened, and I followed. And I get to do that every day. And it's sort of a cheat code that every person I'm praying over as I'm looking at their study as to how I can help them. And so that takes up a lot of my faith component because it's ingrained into my work. And my family is absolutely vital. And it's, my kids will tell you, they'll complain because I'm taking phone calls during our family events, or, I've got someone calling me and texting me on Christmas Day about a case. And, I am not always present in those times, and they'll complain about it, but they understand that I'm doing it for a bigger purpose. And I think that's the biggest part that sets apart the balance is that my family knows and understands what I'm doing and what the calling is. And to balance those four things is difficult. There's no hack that I have. I go through times where I'm working out 6 times a week, and then I go through times where I haven't worked out in a week because my work has just gotten so busy. But the focus on my faith being enacted through my practice, that's probably the biggest cheat code to how I'm able to have a fulfilled and meaningful life without with such demanding profession.
Well, if you all are anything like me, you have more questions that are popping up and would love to keep this thing rolling. And for a group of you, we'll get to keep things rolling. But before we dismiss, and I'll have some special dismissal instructions, I just want to point out to you all, as we talk about balance and work pressure and trying to balance things out in life and time and values and all of those things, what Dr. Sigmund has showed us today is that he's passionate about what he does. He's passionate about God and loving others. And by being here today, he's showing his passion for you all and his care for you all and inviting you into this and sharing a little bit about what he does. And this is a sacrifice and a commitment from him because he cares about what he does, he cares about God, and he cares about you all. So before we dismiss today, can we have a nice, huge round of applause for Dr. Sigmund for being here today?
This episode has been a production of the Capistrano Valley Christian Schools Podcast Network. CVCS is a Christian TK through 12 school in San Juan Capistrano, California. Please visit cvcs.org/podcasts to listen to the variety of shows our students produce on our campus. You can also find all of our shows on Apple Podcasts, Spotify, YouTube, and others. We would also appreciate you subscribing to and leaving a review of this show and the other shows on our network in your podcast player of choice. If you have any questions or would like to reach out to us, please email podcasts@cvcs.org. On behalf of the school, this is Mr. Jasper, the executive producer of the podcast network. Thank you for listening and stay tuned for more.